Today's Health Watch highlights the importance of getting a colonoscopy. It can catch colon cancer early. Shelley Botat introduces us to a local man who believes in their life-saving effects.
Getting a colonoscopy is one of those procedures that has the ick factor. Nobody wants to talk about it, and the thought of having colon cancer surgery and maybe having to wear a colostomy bag scares a lot of people. But it's better than possibly missing being diagnosed with cancer. 44-year-old John Day was feeling fine, but
Listen to your heart and lungs here, okay?
I noticed I had blood in my stool.
And having a family history of colon cancer, John went to see his doctor.
My mom's mother died of colon cancer, and my father and one of my brothers have had polyps removed.
John was then sent to Dr. Eric Johnson, a colorectal surgeon with Aurora BayCare Medical Center.
Our first plan was to see the source of his bleeding, and he had a colonoscopy.
Some people are reluctant to get a colonoscopy, but
if you've never had a colonoscopy, it's really a piece of cake.
It's a good thing John went. Dr. Johnson found a cancerous tumor in his large intestines.
Samples were taken of that, and it was found to be a cancer.
And then November 2nd, I got that wonderful call that I had cancer. Part of me kind of expected it. I wasn't really surprised. My wife was kind of devastated.
In December, John went under the knife to remove the cancerous tumor.
We removed basically about 2 feet or so of the end of the large intestine.
I was amazed at how quickly my body recovered. I was up on my feet the next day.
Since part of the colon was removed, John needed an ileostomy to let the new connection heal.
So an ostomy is when we bring the bowel out to the skin temporarily. So in his case, we used the small intestine and brought that out to the skin to divert everything that he would eat away from our new connection.
Which means John had to wear a colostomy bag.
It was a pain in the butt, but it's temporary. You know, you can live with almost anything for a couple of months.
2 months later, John had his ileostomy reversed.
We almost always reverse it.
And John is now...
I'm cancer-free.
I think he had a very good outcome because he saw his doctor early after he started having symptoms.
Now, John is only one of about 5 to 10% of colon cancer patients that needed an ileostomy and had to wear a colostomy bag. So it is rare for someone who has colon cancer to have to use the bag. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. In the studio, Shelley Botat, Local 5 News HD.